Think about this. Your toddler is supposed to say 50 words by their second birthday. 50. But the average 2-year-old? They're saying 200 to 300. So when your child is nowhere near that number, is it just a late start? Or is something bigger going on? In this video, we're covering 5 red flags that separate a late talker from a true speech delay, and the specific test pediatricians use to tell the difference. A quick disclaimer though, this video is not a diagnostic tool. It's a guide to start a conversation with your pediatrician. Welcome back to the 3 Koi Fishes channel. We're a team of parents with over 80 years of combined experience, sharing research-backed insights to help you parent with confidence. Today, we're breaking down one of the most searched questions in parenting forums, toddler speech delay. When should you worry, and when should you stop worrying? Let's start with the terms most parents get wrong. Speech delay. Your child understands language and knows what they want to say, but their mouth can't form the words clearly yet. They have the script, the actor is still rehearsing. Language delay. This is bigger than how they sound. It's about understanding and using words to communicate. A child with a language delay might struggle to follow directions or not use gestures like pointing. Late talker. According to the American Speech Language Hearing Association, a late talker is under 3, developing normally in every other area, motor, social, understanding, but slow to start using words. About 13% of 2-year-olds fall into this group. The critical difference? A late talker catches up. A child with a true delay needs support. Knowing which one you're looking at, that's where the milestones come in. The CDC recently updated their milestones to reflect what most kids actually do, rather than just what we'd hope for. The whole point? Catch things early so we can start helping early. At 12 months, you're looking for those mama and dada consonant sounds. They should be using gestures, think waving or pointing, responding when you call their name, and ideally having 1 or 2 words they use with real meaning. By 18 months, we want to see about 6 to 10 words used consistently. They should be able to point to an object when you name it and follow a simple one-step direction, like pick up the toy. Now, 24 months is where it gets critical. The CDC sets the milestone at 50 words, but remember, 50 is the floor, not the ceiling. The average 2-year-old actually has closer to 200 or 300 words. They're starting to link them together. More juice or daddy go, and a stranger should be able to understand about half of what they say. By 36 months, we're looking for 3 to 4 word sentences and a vocabulary of 200 plus. At this stage, they should be 75% intelligible to people outside the family, and they'll start hit you with those who, what, and where questions. If this breakdown is helping you navigate all the noise out there, give this video a thumbs up. It really helps us know we're hitting the topics you care about. Now, if your child isn't hitting these exact numbers, does that automatically mean a delay? Not necessarily, but there are 5 specific red flags that tell you it might be more than just a late start. Red flag 1, no babbling by 12 months. Babbling isn't random noise. Those ba-ba-ba strings are practice for language, building muscle memory for speech. The National Institute on Deafness says babbling typically emerges between 6 and 10 months. No babbling by 12 months can indicate hearing difficulties or early developmental differences. A late talker babbled on schedule. They just took longer to turn babbles into words. Red flag 2, no pointing or gesturing by 12 months. Before words, children use gestures. And there's a key distinction. Imperative pointing means, I want that cookie. Declarative pointing means, look at that airplane. Do you see it? Research shows the absence of declarative pointing by 12 months is one of the strongest early indicators of a communication difference. A late talker still points and waves. A child with a true delay often won't. Red flag 3, no single words by 16 months. Most children say their first meaningful words between 12 and 15 months. By 16 months, with no words beyond mama and dada, That merits a professional evaluation. Red flag 4. No 2-word phrases by 24 months. 2-word combinations like more milk show your child understands language as a system, not just labels, but a tool for expressing needs. If your 2-year-old is still using only single words, bring it up with your doctor. And last, red flag 5, loss of previously acquired skills. This is the most urgent sign on this list. If your child was saying words, making eye contact, or using gestures, and then stopped, that warrants immediate attention. Late talkers don't lose skills. They gain them slowly. Regression is fundamentally different, and it should never wait. One sign alone doesn't mean delay, but a pattern or that gut feeling something is off, that's when to look deeper. The question that keeps parents up at night, is it speech delay or is it autism? They can look similar in the second year. Both may involve limited words, but they are not the same. A child with an isolated speech delay typically makes good eye contact, responds to their name, uses gestures, engages in pretend play, and understands what you say, even if they can't say it back. A child showing signs of autism alongside speech differences may also display consistent lack of response to their name, limited or declining eye contact, absence of declarative pointing, repetitive motor movements like hand flapping, insistence on sameness, or regression in language or social skills. The American Academy of Pediatrics recommends the MCHAT screening at 18 and 24 months. A speech delay can exist on its own or coexist with autism. The only way to know is through a professional evaluation, and that evaluation is something to use, not fear. If some of these signs hit home, do not panic. Your child is the same wonderful child they were before this video. These signs are signals, not a diagnosis, but they are signals you should act on. Step 1. Document. Be specific. Instead of he's not talking, try he doesn't use any words at 18 months, but he points and responds to his name. That detail helps your pediatrician immediately. Step 2. Schedule with your pediatrician. Ask about developmental screening. Download the CDC's free Milestone tracker app before your appointment, so you arrive with data, not just worry. Step 3. Request a speech-language evaluation. A speech-language pathologist can determine if it's a speech delay, a language delay, or simply a late talker. They can also check for hearing issues, which account for a significant number of speech delays. Step 4. If concerns persist, ask about early intervention. Research from the Journal of Speech, Language, and Hearing Research shows children who receive intervention before age 3 show significantly greater improvement than those who start later. The brain is incredibly malleable in early childhood. Acting early isn't about fear, it's about empowerment. If you want to hear from a real-life father raising an autistic son, be sure to catch our video here. Raj provides valuable insights and proactive actions one can take as parents. You won't want to miss it. Okay, let's do a quick recap of those 5 red flags. 1. No babbling by 12 months. 2. No pointing or gesturing by 12 months. 3. No single words by 16 months. 4. No 2-word phrases by 24 months. 5. Loss of previously acquired skills at any age. One sign isn't alarm. A pattern is a reason to be proactive. Like and subscribe for more research-backed parenting advice. Links in the description for the CDC Milestone Tracker and all the resources we discussed. You're doing a great job. We'll see you in the next one.